Graham Windham was founded in 1806, when there was no child welfare system, by a group of 4 women determined to provide a home for orphans. We've built on their legacy with a mission that focuses on family. We empower parents with the skills they need to parent well, despite myriad stressors in their lives. We're committed to partnership with them and the community toward our mutual goal of providing children with a safe, loving, permanent family, and the opportunity to thrive in school and in the world. A key goal is to change how the child welfare system works with young people and their parents. Generally, the system decides whether it's safe for a child to return home based on the parent's completion of mandated services, which may or may not target the cause of the maltreatment. We're investing in interventions that instead produce lasting behavior change by helping parents develop and practice parenting skills. We must also stick with kids as they grow, nurturing them emotionally and academically, surrounding them with positive adults and peers in after-school and other programs, and launching them into a viable career. Unlike other large agencies that increasingly diversify their programs, we're instead intensifying programs in target areas of child welfare and juvenile justice. As a result, we transitioned away from our early childhood programs, despite the resulting budget decrease. In 2011, we adopted an agency-wide practice called solution-based casework, shown to reduce rates of abuse and neglect. We introduced the model to New York, and it's now being adopted by a growing number of the city's child welfare agencies. One of our key strategies is to maintain a high degree of focus on our performance. Our program performance and planning team rigorously assesses outcomes for the children and families we serve, and we use the data to inform the decisions we make agency-wide. There is critically important information embedded in the analysis of our failures, which we can use to improve practices. We've also made a commitment to focus primarily on well-defined interventions that have research to support them. We have a strong focus on performance, starting with our board's Program Performance Committee, which leverages our board's experience at McKinsey & Company and other organizations. We develop a comprehensive set of outcomes related to children's safety, their permanent connection to a loving family, stability, education, and well-being. We rigorously collect and analyze data and use this information for cross-divisional strategic planning and continuous quality improvement. This process informs all areas, from our long-term strategic vision to ongoing program development to targeted training for our staff. We do whatever works best, whether a time-tested intervention or a newer, evolving model. Also, there's some sense that child welfare agencies dictate what families must do to keep their kids out of the system. Our approach is to engage families, helping them see what's best for their child, and partnering with them on effective, feasible strategies. There's also the idea that our services should be entirely government-supported. However, public funding is not always in step with the needs we see on the ground. We've identified the gaps and approaches required, and need private supporters to help carry them out. We've significantly reduced the incidence of repeat child abuse in families in our foster care prevention programs. The percentage of children who enter foster care after receiving preventive services at Graham Windham is also at an all-time low. In our foster care programs, we've reduced the number of times children are moved between homes, increasing their sense of stability. We've also achieved very high graduation rates at the Graham School. All children need a strong education, positive peers, and adults who expect and help them to be great. Unfortunately, the child welfare system isn't designed to do this. It cuts ties and funding right when support is needed most, the day a child returns home from foster care. The child welfare system also pays agencies for each day that a child is in care, almost incentivizing the long stays that are so damaging to children. We're building a different way, in which we will not be bound by these constraints, and we need your help to get there. First, we're planning parenting interventions to teach and intensively coach parents to meet the specific challenges they face in creating a safe, nurturing home. Second, we commit to stand by their children, giving them the preparation to succeed. Gradually, we'll expand the Graham School, a residential school in Westchester to the north of the city, into the Bronx and other New York City neighborhoods where kids need intensive academic supports. We will increase the availability of therapeutic treatments that are effective with young people who have experienced trauma. We will launch a new career readiness program, and we will expand our innovative Bangles program, which teaches young people to be positive, service-oriented leaders. While we help parents develop parenting skills, a gap is addressing their issues as individuals, such as domestic violence, substance abuse, and mental health conditions. We also need expanded investment in specific evidence-supported models and approaches that we believe will work for us. We're often constricted by what government agencies support, but these models may not be sufficiently researched or the best fit for our children and families. Private support will free us from these constraints so that we can make program choices based on what will achieve the desired outcomes we've targeted.